This is Dr. Jason Lichten, board certified plastic surgeon and founder and director of Central Ohio Plastic Surgery. So today I want to talk a little bit about the power of the Juvederm family of hyaluronic acid fillers and how we use those to combat aging and provide facial restoration and rejuvenation. Patients always come in and say, I don't like these lines on my face, but really what is it about the lines? It's that we look in the mirror and we see tired, angry, sad, old. Those are the adjectives that I hear most. Now, it used to be that we would use Juvederm Ultra or Ultra Plus to sort of fill lines around the mouth and just chase lines. When in essence, the real reason that people see aging is a lot of volume loss, both soft tissue and bony loss. It's not always just skin laxity in terms of what a facelift can do, but it's more about you lose volume in your cheeks, you lose volume in your jaw, your lips, the area around your mouth that makes us look tired, angry, sad, and old. To combat that, Juvederm, which is hyaluronic acid, a normal component of the skin, can be injected in different areas in the face to restore and rejuvenate those areas. Now, it's not a one-size-fits-all. The products have evolved and have different levels of hyaluronic acid in them that lead to different tissue principles. Now, for me, Voluma is my first choice for rejuvenation and restoration of the face, cheeks, restoring that soft tissue and bony loss here that makes us look sad and gaunt. That's probably the workhorse that does more than any other fillers that we have. Volux, same like Juvederm, like Voluma, is thicker, layers out on the bone, but Volux we typically use along the jawline. Now, patients often say, well, I don't want a fuller, more prominent chin and jaw, and that's not what it's entirely about. Now, it can be used. I can use Volux to augment a chin and give a stronger profile, but for more often than not, I'm using it to sort of fill the area where there's a little bit of gelling, give some support along the jawline to make this look more rejuvenated. From there, Juvederm Velour is sort of an intermediate thickness. We'll use that to fill in the lines around the nasal labials and marionettes after we've sort of done that restoration of setting that foundation with Voluma and Volux. And then you get into Volbella for lips, or for lines around the lips, or infraorbital hollow, Juvederm Ultra that we use to augment the lips and add volume there. And the newest is Skin V, which is not really a filler, but it's hyaluronic acid in a micro droplet form that we use to sort of improve the glow and radiance of the cheeks themselves. Using these all together are not a substitute or replacement for what we can do surgically with a facelift, but for patients who aren't ready, oftentimes we'll use these fillers as a bridge to a time when you will be ready for surgery.